a weekly program about events in the two Virginias.
Welcome back to In Focus, everyone. Dr. Horwitz is sharing a lot with us about platelet rich plasma, which is a type of treatment that can help out people without actually needing surgery. And let's talk about that now. Some of the different types of treatment options that are really used a lot right now, starting off just with people actually getting rest.
Yes. There are basically several treatments that are used. And I'm going to talk about sprained ankles, but it could be about an elbow, it could be about a shoulder, it could be about a back. One of the best treatments is to, one, give the part a chance to heal. And when you notice that when you injure something, it swells. Well, it swells because Mother Nature is doing what? She's putting in plasma, and she's activating the things and trying to get Mother Nature to heal herself. So rest with gentle walking or gentle exercise, nothing too strenuous, works very well and it's inexpensive. And if you keep away from aspirins and ibuprofen, you'll be fine. Tylenol is fine, and you'll say, why Tylenol? Because non-steroidal, as I said before, reduces the prostaglandin P2G. Tylenol, acetaminophen, doesn't. Mm-hmm. What can I tell you? So, that's rest. So let's say now you did all the rest and you're still limping, you're still hurting. What else can you do? Well, you can try the non-steroidals. Ibuprofen, Indocin, Celebrex, you name it, you can do it. What does that do? That reduces inflammation. Sometimes that's really more than just enough. What is the problem with it? More people die every year from aspirin overdose than any other drug on the market. And someone had said that if today aspirin would have had to have a prescription. Mm. And so aspirins are really dangerous, especially if you're on blood thinners, Plavix. It interacts with multiple things. And when you say, well, I'm taking Motrin, well, Motrin is aspirin. Ibuprofen is aspirin, and you need to get to a therapeutic dose. Oh, well, therapeutic doses are really high. People get stomach upset, bleeding ulcers, etc. So it's okay, not the greatest. Well, what's the next thing? Well, physical therapy. Physical therapy tries to restore the range of motion, and that also works. Everything I'm going to tell you does work. How well does it work? It's an individual thing. So physical therapy, which would entail strengthening muscle, range of motion, massage, ultrasound. The newest thing that we're using is laser because it's much better. That works out well too. And finally, you could inject cortisone into the joint. What's the problem with that? That does help. But what's the problem? What does cortisone do? Cortisone is a naturally occurring hormone. You make it, I make it, we all make it. But what does it do? It reduces inflammation. How does Mother Nature heal? She heals by inflammation. What are you doing? You're stopping inflammation. But do you get better? Yeah, you do get better. What's the consequence of it? Bones get softer, tendons rupture, fractures don't heal. Okay, that didn't work. Now what am I going to do? Well, I'm going to go to the surgeon. And what is he going to do? He's going to put me in the ER, in the operating room, the OR, give me general anesthesia or local anesthesia. Is there any problems with that? Yeah, people don't always do so well. He's going to cut it open. He's going to take out the bad tissue, going to sew the good tissue together, either with stitches or with pins, needles, screws, plates, you name it. Sew it all back together. You're going to have to take it easy while Mother Nature heals what the surgeon already did. And you're going to hope that you don't get an infection, you don't have a problem with the drugs, that the hospital treats you nice and the food is good. Well, 1 out of 4 isn't bad.
Right.
or you're going to try a more natural approach, which would be PRP. It has a good chance of healing, and if it doesn't work, you can go back and do the other thing. So for me, as I said to you with my back, rather than have somebody go in and do a fusion on my back, I went up to Boston and had that done. They use it on knees, they use it on feet, of ankles, I do. They use it on shoulders, torn rotator cuffs and all that. Worst thing could happen. You know, doctor, that didn't work. I'm no better today than I was yesterday, and you cost me all that money. I'm sorry. That's true. But did I cause any harm? Well, no, not really. Well, I guess then I did figure out the Hippocratic Oath.
And speaking of that, I know, like we've been saying, it's kind of new in this area. We're almost out of time, but I know you wanted to mention the long history that goes back with this.
Yes. The history is really long. We know, and I was telling you, that we have records from Pharaoh, and you know how long that is from your Bible history, that when Pharaoh horses would break a bone, and generally the bone they broke was called a gopher bone. Somebody once asked me to treat their horse, and I looked at the horse looked at me, and I decided that wasn't what I was going to do. But the pharaohs used to take a nail and put it through the bone, and then the bone would heal, because you stimulated healing. Dr. Hippocrates, who was a Greek physician, and we have the Hippocratic Oath, and we swear the oath to Hippocratic when we get our medical degrees, our podiatry degrees, and the first thing that he did is a very interesting story, and it's been well documented. A spear thrower came to him, and he couldn't throw spears, so I guess he couldn't get a job. He was on the unemployment list, and Hippocrates took a long needle, heated it. They must have been really tough people. Just the thought of it, just terrible. And he scarified with this hot poker iron, if you will, the ligament in the shoulder, and the spear thrower went back throwing spears. We don't know what happened to him. I guess he retired to a long life, hopefully.
Right, but like you said, goes back into history. And we're actually, unfortunately, out of time, but thanks so much for joining us.
Thank you for having me.
And if you guys want to see more information, you can go to Health Connections on WVVA.com, and Dr. Horwitz has a lot of information on that page. So thanks so much for joining us. We'll see you again next week on In Focus.